Next one, we'll go and start this with to Dr. Jones. There's a question about the BEAR trial. So that for those that aren't familiar, this is a procedure, and I'll maybe let you go into more detail about this, but that uses a scaffold or a sponge to facilitate ACL repair. And there's an ongoing clinical trial that's gotten a lot of publicity, and I wonder if you had any thoughts about that, the procedure, or maybe the promise of it, or anything along those lines.
Yeah, I think Martha Murray and her group in Boston, they're doing a lot of great work. The real thought behind this is that we would be able to use a patient's own tissue to reestablish normal kinematics and joint stability, and we would no longer have to use allografts, which we know have a higher failure rate, and the risk of disease transmission, and then also the joint morbidity that we see associated with autograft tissue. So I think it's very promising. The difference between this in terms of ACL repair and what I was talking about is that this is really sort of using the biology that we see from a basic science standpoint we know is beneficial, and incorporating it into clinical use. So this is using a scaffold where it's basically collagen-based and platelet-rich plasma, getting those cytokines, growth factors that we know enhance healing, to get the ligament to heal side to side. What I was talking about before with an ACL repair is where surgeons are selectively, based upon MRI appearance, saying this ligament has torn off the bone, I'm going to use an anchor to reattach it to the bone and really do nothing else. So it's a little bit different, even though we're sort of still saying it's an ACL repair method. But I think there's a lot of promise here, and if this pans out, it's really going to change the way we do the surgery.